GLP-1 medications are either being called miracle drugs or being blamed for everything from muscle loss to ruining your metabolism. And almost all of that conversation is wrong. Today, we are separating myths from facts using a real physiology, real clinical data, and real world experience. Not fear, not hype, and not influencer opinion. If you ever wonder whether GLP-1 medications are safe, sustainable, cheating, dangerous, or life-changing, this video is for you. If you are new here, I'm Jay Patel, certified PA specializing in hormones and vitamins. This channel exists to explain how the body actually works, without shame, without hype, and without nonsense. This video is educational only. No medical advice, no prescribing, no promotion. But if you or someone you care about struggle with weight, insulin resistance, food noise, or metabolic diseases, understanding GLP-1 medication matters. GLP-1 medication exploded into a mainstream faster than the science could catch up. Social media simplified a complex metabolic therapy into clickbait. Because fear sells, outrage spreads, nuance disappear. So today, we are restoring nuances. Myth 1. GLP-1 medications are just appetite suppressant. This is one of the most common misconceptions. GLP-1 medication do reduce appetite, but that is not their primary purpose. The fact is, GLP-1 is a metabolic hormone, not a stimulant. It slows gastric emptying, improves insulin secretion, reduces post-meal blood sugar spike, signals satiety to the brain, reduces food noise, and reward-driven eating. This medication doesn't force you to eat less. They help your body respond to food more appropriately. GLP-1 medication causes weight loss by starving you. This myth assumes weight loss only comes from deprivation. The fact is, GLP-1 medication reduces pathological hunger, not normal hunger. Most people still eat. They just stop battling constant craving, binge urge cycle, and food obsession. For many patients, this is the first time eating feels natural instead of exhausting. That's not starvation, that's hormonal correction. You lose all your muscle while taking GLP-1 medication. This is a fear-based oversimplification. The fact is, any weight loss from diet, surgery, illness, or medication can reduce lean muscle if resistant training and protein intake are inadequate. GLP-1 medications are not unique in this regard. Muscle preservation depends on strength training, adequate protein intake, gradual supervised weight loss. GLP-1 medication do not selectively target muscle. GLP-1 medication destroys your metabolism. This myth is often repeated by people who misunderstand metabolic adaptation. The fact is, obesity itself damages metabolism. Insulin resistance, leptin resistance, and chronic inflammation impaired metabolic flexibility. GLP-1 medication improves metabolic signaling. They don't break metabolism. They often restores it. Taking GLP-1 medication is cheating. This myth is rooted in moralizing weight. The fact is, using medication to treat a medical condition is not cheating. We don't call blood pressure medication cheating. We don't call insulin cheating. Obesity is a chronic metabolic disease, not a character flaw. GLP-1 therapy treats biology, not behavior. Once you stop GLP-1 medication, you will gain everything back. This is partially true and often misunderstood. The fact is, obesity is a chronic condition. When treatment stops, biology often reasserts itself. This is true for blood pressure, cholesterol, diabetes, and weight. That does not mean treatment failed. It means the condition is chronic. While taking medication, lifestyle improvement is important. Long-term strategies matters. GLP-1s are only for obesity. This myth ignores decades of research. The fact is, GLP-1 medications have documented benefit beyond weight loss, including improved insulin sensitivity, reduced cardiovascular risk in high-risk patients, improvement in a fatty liver disease, reduction in inflammatory markers, reduction in compulsive eating behavior. These are metabolic medications, not cosmetic drugs. They ruin your digestion permanently. This is fear-based exaggeration. The fact is, GLP-1 medication slows gastric emptying temporarily while active. This effect is reversible. Most GI side effect occurs during dose escalation and improves with time. Permanent digestive damage is not supported by clinical evidence. Everyone should be on GLP-1. This is the opposite extreme. The fact is, GLP-1 medications are not appropriate for everyone. They require medical evaluation, risk assessment, ongoing monitoring. They are tools, not lifestyle replacements. Microdosing GLP-1 medication is a hack. This topic needs careful discussion. The fact is, there is growing scientific interest in lower dose metabolic support, especially for insulin resistance, appetite regulation, and metabolic flexibility. However, this is an evolving area of research. No universal approach exists. Any use must remain under medical guidance. Here are the real side effects of GLP-1 medications without fear. GLP-1 medication can cause nausea, fullness, reduced appetite, GI discomfort. These effects are dose dependent and often transient. They are not signs of toxicity. Education and supervision matters while on GLP-1 therapy. Why this medication feels emotionally charged? GLP-1s challenge long-term held belief about weight, discipline, and self-worth. If biology matters more than willpower, shame collapses. That makes some people uncomfortable, but discomfort doesn't change physiology. The bigger picture is that GLP-1 medication represent a shift in medicine, from punishment to treatment, from blame to biology, from shame to science. They are not perfect, they are not magic, but they are powerful tool when used correctly. If weight loss has always felt harder for you than everyone else, it may not have been your fault. Your biology may have needed support. Understanding GLP-1 medication helps replace judgment with clarity, and clarity changes everything. If this video helped you separate fear from fact, subscribe. If someone you care about is confused or overwhelmed by GLP-1 medication, share this. And if you want real metabolic education without hype, stay here and I'll see you in the next video.